Emergency contraception is one of the methods of contraceptives used to prevent unintended pregnancy. The modern methods are not new to Nigeria because Nigeria was one of the countries around 1998 that domesticated the use of emergency contraceptives.
Nigeria was one of the first countries to have a socially marketed emergency contraception product. EC has been a part of the family planning method mix for more than 20 years in Nigeria. So it's a very dynamic market and a dynamic commercial space with two socially marketed products. Access has stalled somewhat in Nigeria, so level of awareness of EC still remains quite low. Only about a third of women in Nigeria are aware that EC exists, and emergency contraception awareness is extremely important because if you don't know about it, you don't know to get it, and there is a very tight time frame to access it. So ideally it should be taken as soon as possible and certainly no later than 5 days after unprotected intercourse. We hope that in the next couple of years we'll see levels of awareness increasing substantially and levels of access for women who are in the poorer sectors of society.
Over a decade ago, the awareness on emergency contraceptive was very low in Nigeria. And around the same time, we got the opportunity to collaborate with International Consortium on Emergency Contraceptive. And to us, this was very good because we were able to deploy various social and behavioral change communication strategy using culturally acceptable languages and materials, including posters and bill. And we also had advocacy meetings with community leaders, service providers, would-be clients, as well as the Emergency Medicine List Committee, which is a national statutory committee to ensure relevant medicine are put on an essential medicine list. We have been able to get the emergency contraceptive into the essential medicine list. And obviously, this will improve access to emergency contraceptive as well as its availability right from primary health center down the lane in the healthcare system.
The International Consortium for Emergency Contraception has been helping Nigerian women and men to promote emergency contraception. They assisted the ministry to develop those guidelines. A fallout of those guidelines is that the country should have a curriculum to train service providers on emergency contraception.
AF was requested at the instance of ISEC to prepare training modules and manuals that will be useful both for the public health providers training and also for other programming like adolescent training on ACP. 2 training manuals were developed by AF. The manual was taken through a very well thought through process where we engaged with the Federal Ministry of Health and other key stakeholders in family planning programming in Nigeria were part of the development of the manual. The process also was pre-tested in order to be able to be sure that those that are ultimately going to use the manuals will be able to comprehend whatever is being put in the manual.
Sometimes in 2017, we got a brief to assist in adapting a French language leaflet on emergency contraception to 3 Nigerian languages. First thing that we did, we met with the reproductive health unit of Federal Ministry of Health to get their buy-in. Then after that, through the Federal Ministry of Health, We had a critical stakeholders meeting to be able to look at the leaflets, after which we went for a pre-test in 2 Nigerian cities. The material is actually meant for women of reproductive age in Nigeria to create awareness for them on the presence of emergency contraception in Nigeria and the fact that emergency contraception is actually available for them in cases of emergency.
Da mu'amala ta faru, ECP baya zubar da ciki kuma ba a yi shi don tsarin iyali ba, sannan ba shi da wata illa. Ana iya amfani da ECP so 6 a wata daya. Ana iya samun ECP a kowane yardaccen shago.
Between the International Consortium on Emergency Contraception and Population Media Center in Nigeria, we came together to drive home the messages of emergency contraception. And we did this through the laid down PMC methodology. The process starts with the scripting of the first 4 pilot episodes, which are written, produced, and pre-tested in the targeted audience. The collaboration between Population Media Center and Emergency Contraception has been very effective because the 8 messages of EC has been effectively delivered.
At SFH, we understand the important role these providers play, and over the years have strengthened their capacity through detailing, product provision, and various means of capacity enhancement to ensure they have the right information, the right understanding, and have the appropriate tools to provide emergency contraceptive services to women and girls.
It's a really dynamic moment for emergency contraception right now because with great support from the Federal Ministry of Health and the partners, we have been able to all push together collectively for some big successes.